Hello and welcome to this presentation on the introduction to the study of Viktor Frankl's logotherapy and existential analysis. This is a brief summary about the online course that we offer through the Ottawa Institute of Logotherapy, which consists of 10 modules. And we thought of offering a brief summary just to outline the course material that you may need for this course, what to expect, what are the modules that we cover, what is the content of the course, just to help you prepare and to get organized as you embark on your studies of logotherapy. This is a professional development course, which means that it is most suitable for professionals from different fields, mostly in the helping professions, who already have their degrees and registrations through their licensing bodies and who are actively practicing, and who would like to gain additional familiarity with Viktor Frankl's logotherapy and understand a bit of the theory and the practice, some of the applications, the methods, so that they can use some of these methods and principles in their own practice, in their own work. So first of all, about the founder is Dr. Viktor Frankl. He was a Viennese Austrian neurologist, psychiatrist, survivor of the Holocaust. His work is carried on by institutes of logotherapy that are accredited by the Viktor Frankl Institute in Vienna. Dr. Frankl was head of the Vienna Polyclinic Hospital between 1946 until 1970, when he retired. He authored more than 40 books, translated to 50 languages. He taught at 209 universities, and he was active until the year before his death. So he retired when he was 70 years old. However, he continued to teach in Vienna and sometimes even abroad. And his last presentation was at the University of Vienna just a year before he passed on. He held 29 honorary doctorates from universities around the world, and he was twice nominated for the Nobel Peace Prize. Some of the books that are available here are the ones that are translated into English. So there are 12 out of 40 books that we have available. Most well-known among these, of course, is Man's Search for Meaning, which is known to the English audience, the North American audience, since 1959. In addition, we have The Will to Meaning available, which goes through with the theoretical background of logotherapy. Search for Meaning is very much rooted in Viktor Frankl's experiences, his way of practicing, and his experiences during the Second World War when he was a concentration camp inmate. He was Jewish, and because of that, he was incarcerated in the concentration camps, where he validated his theories that he started to develop before the Second World War. So Will to Meaning continues to expand and summarize and present the principles of logotherapy. Doctor and the Soul, likewise, is based on his medical practice and practice in psychiatry. The Unconscious God is another book, Psychotherapy and Existentialism, Recollections, which is an autobiographical writing. Autobiography, however, with a special intention to present the chronology of the development of logotherapy. So going back to the background, to his past, to his parents, all the way to growing up as a young doctor practicing, how he came to develop logotherapy, what were the reasons, what was the historical context, and how did the evolution of logotherapy then continue from there on in Vienna and elsewhere. Man's Search for Ultimate Meaning is based on Dr. Frankl's doctoral dissertation. Then is on the theory and therapy of mental disorders. This book is fundamental because it outlines really Dr. Frankl's theory of neurosis and his way of practicing. So this is fully compatible with the DSM-5 current diagnostic system. Feeling of Meaninglessness, these are more recent publications. Yes to Life in Spite of Everything, and the latest one just published 2 years ago, Embracing Hope on Freedom, Responsibility, and the Meaning of Life. Now, the official curriculum of the Viktor Frankl Institute was developed by Dr. Elizabeth Lucas, who is considered the most important, the most well-known student of Dr. Viktor Frankl. Professor Lucas lives currently close to Vienna. She was born in 1942, and from 1986 to 2003, she was the founder and the leader of the South German Institute of Logotherapy, where she trained generations of logotherapists. She's the author of 40 plus books on logotherapy, and I'm saying 40 plus because she keeps actively writing, and almost every year there's a new book that appears in the German language. In English, I have some of her most well-known books listed, and I apologize if some are not on this list. But these are the most well-known ones and the most significant ones in the English language that are available. And among them are the Logotherapy textbook, Meaning-Centered Psychotherapy, Logotherapy Principles and Methods, Psychotherapy with Dignity, Meaning in Suffering, Stillness and Concentration, and others. So if you do a Google search or you go to the archives, the Elizabeth Lucas archives online, you would be able to find many of the publications, and including the current updated list of the publications in German, English, or other languages. The accreditation of the courses is taken care of by the International Association of Logotherapy and Existential Analysis at the Viktor Frankl Institute, Vienna, and coordinated by its head, Professor Alexander Batthyány. He's the editor of the complete works of Viktor Frankl, which is 5 volumes, which are already currently available. More are coming out. And about every second year, every year, they publish also Logotherapy and Existential Analysis, the Proceedings of the Viktor Frankl Institute in Vienna, which contains up-to-date review and research articles on logotherapy. The Ottawa Institute of Logotherapy has been in existence since 2012. It is led by myself, Dr. Maria Marshall. I'm a professor at the Graduate Theological Foundation. I'm also a registered psychotherapist, and my background is in counseling psychology and psychotherapy. My husband is Dr. Edward Marshall. He's also professor at the Graduate Theological Foundation. His background is in medicine. He was a family physician, emergency doctor, and after that, his PhD degree was in neuropsychiatry. He also did a special diploma in clinical psychiatry and practiced in the United Kingdom. Since we moved to Canada, we are both psychotherapists and work in our own independent practice. So that's how we established the Ottawa Institute of Logotherapy, in order to teach others about what we have learned from Dr. Elizabeth Lucas. My father was a student of Viktor Frankl, so as well from him, from his books, and from studying with other logotherapists. The course is based on the textbook, our textbook. Over the course of several years, we authored about 17 volumes on logotherapy, and the thickest volume is Viktor Frankl's Logotherapy and Existential Analysis Theory and Practice, which is a blue book, which I showed it at the beginning, with the cover of Dr. Viktor Frankl on the top. So that's the textbook that we are using. It's a current textbook, and that's what we are using for this professional development course. The outline of the course is based on the curriculum of Dr. Elizabeth Lucas, what she was teaching at the South German Institute of Logotherapy. And it is based on our studies with Dr. Lucas and other logotherapists, as I mentioned that earlier. It has 10 modules, and they are built up as follows. These are the objectives. The objectives are to familiarize students with the historical context within which logotherapy and existential analysis was conceptualized, outline the basic principles and tenets of logotherapy and existential analysis, present logotherapy and existential analysis' view of the person that is the basis of therapeutic interventions, illustrate the use of logotherapy's methods with clinical examples, highlight research results on the application of meaning-centered principles, enhance discernment about when logotherapy and existential analysis is a method of choice and when it can complement other treatment interventions, and foster the development of one's competence in applying logotherapy and existential analysis, its principles and methods whenever it's applicable in one's own work. So the modules from 1 to 5 are as follows. Module 1 presents the roots, origins, rationale, the context of logotherapy and existential analysis. Basically, it focuses on being and meaning. Module 2 presents the basic theoretical foundations of logotherapy. These are called the 3 pillars of logotherapy, namely the freedom of will, the will to meaning, and meaning in life. Module 3 deals with logotherapy's view of the person, the anthropological model of the person, according to Viktor Frankl. Module 4 discusses the characteristics and dynamics of the human spirit. And this module is important because, of course, in logotherapy, the human spirit is a healthy resource and is the most important resource that we use in helping our clients and our patients to advance towards meaningful and purposeful goals. So the human spirit is the treasure chest of logotherapy. So it has very special importance to discuss this topic. The module 5 discusses the concept of the tragic triad, pain, guilt, and death. And this constitutes the triad of suffering. Then in the face of suffering, how do we find meaning is through the value triad. The value triad of creative, experiential, and attitudinal values. And we also discuss Viktor Frankl's psychological and psychiatric creed. So these are the basic principles of logotherapeutic practice. Modules 6 and 10 discuss the process of existential analysis and existential formulation. So here students gain an understanding about what's specific about a logotherapeutic formulation that can really complement other interventions, or they can stand alone, of course. But what constitutes an existential formulation and how this adds and how this presents a more holistic understanding of the person, a fuller understanding of the person, because it also, of course, incorporates the existential element of the concerns that are presented and also potential resources. So what goes into the existential formulation? What's the significance of it? And how do we arrive at an existential formulation that is compatible with our work according to the DSM-5 principles and modern principles of practice? Module 7 introduces two dialogue forms in logotherapy. So this is a very important element as well, because logotherapy's methods are paradoxical intention, dereflection, and Socratic dialogue are presented, but these methods are based on very well-developed principles for active listening, being with, paying good attention to the nuances, the viewpoints, the shades of expression, and being with our patients and our clients in the therapeutic sessions. Module 9 goes on to discussing, I think I skipped Module 8. Module 8 discusses other useful methods in logotherapy. So other than paradoxical intention, dereflection, Socratic dialogue, which are the other techniques, which are the other methods? And logotherapy has many for different uses and different situations, different scenarios. So we talk about those as well. Module 9 talks about then the evidence-based practice of logotherapy and existential analysis, which is the wealth of research that is available to show the effectiveness of the use of logotherapeutic principles in practice. And finally, Module 10 talks about multidisciplinary and transcultural applications of logotherapy, summarizes the significance of using logotherapy and existential analysis in practice. Now, I also wanted to talk about the requirements. So when students want to study Viktor Frankl's logotherapy and existential analysis online and through um, a curriculum that requires intense training, but some of the reading they have to undertake between the meetings and on their own. How do we go about then the requirements and the study materials? So students are required to read the assigned chapters and texts, and some people are, you know, like everyone is allowed to advance at their own pace. So some people do maybe one module a month, some people maybe one module a week. It doesn't matter at what speed one goes through the material. What matters is that one really understands and comprehends what one is reading, and if one has questions, then we have an opportunity to discuss those questions and reflections and observations during our 30-minute interaction, which is tutoring following every module. So that's 30 minutes in length after every module. There is also a reflection paper that students are asked to 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 complete, and that is usually about 500 words. So like 1 or 2 pages of an answer to a selected reflection question. That's just to facilitate our conversation and to demonstrate understanding and advancement in knowledge. And there is a final paper which is submitted at the end after the completion of the 10th module. And it is about 3,000 words in length, which is about 10 pages, to show a summary of understanding knowledge. So upon completion of the course takes about 120 hours of professional development time. So it's estimated that students are really intensely immersed into the study of logotherapy and existential analysis in between the meetings, and that they really familiarize themselves with the literature that we assign and that is required to be read. We then issue a professional development diploma, which can be used toward applying for membership in the International Association of Logotherapy and Existential Analysis in Vienna. That's the Viktor Frankl Institute in Vienna. And this course meets the minimum requirements for training, which means that, of course, one would be continuing to consult on a regular basis or as desired with other professionals and colleagues and continue the education. So it's a commitment to ongoing education, training, and development that one would then undertake to really familiarize oneself with the concepts of logotherapy. And of course, as one applies them, when questions come up, to be able to reflect on them, to be able to discuss them with one's mentor or one's teacher or colleagues and professionals in the field. Then one can consult with respected professional bodies regarding the use of this course to qualify for professional development hours. I know that, for example, here in Ontario, the Counselors Association grants 120 hours of continuing professional hours for the completion of this development diploma. So if it is something that you would like to continue to study, and if Viktor Frankl's logotherapy and existential analysis piqued your interest and you think is something that you would like to know more about and you would like to study with us, please feel free to contact us and ask any questions that you may have, and join a growing group of discerning and caring professionals who are ready and waiting and open here in Canada and beyond. Thank you very much for your attention.